In our next series, we are going to explain causes of fibroids, fibrous initiation, and fibroid vascularity. You are welcome back to this series, Fibroids Awareness, powered by Fibroids Explained, a comprehensive guide to understanding, preventing, treating, and managing fibroids naturally. From Leading Care Medics. I am Dr. Abdullah. In this edition, we want to explore what fibroids are. What fibroids are. Fibroids are non-cancerous growths. They are not cancers. They are found in the uterus, and they can affect human and their health, their reproductive life seriously. So we need to understand fibroids clearly. We need to understand fibroids clearly. Now let's go. By definition, fibroids are benign. Benign, when they say something is benign, tumor, cancer, it means it's not a cancer. So when we're talking about tumor, we have two types. It's either it is benign tumor or cancerous tumor. So cancer is, fibroid is also a tumor, but it's a what? It's a benign tumor. So benign tumor ni pé kò kí ń ṣe cancer. So these tumors, that is the fibroids, they grow around the uterus. So inú ilé ọmọ, tá a mọ̀ sí womb, ibẹ̀ ni fibroids máa ń grow around it. So now, and this thing we are talking about are made up of muscle and fibrous tissue. Kí ni nǹkan tá a wá gbà lérò pẹ̀lú ẹ̀? A ṣàlàyé lẹ́fọ̀ọ́sẹ́wẹ́. N tá a pè ní uterus tá a mọ̀ sí ilé ọmọ, ó dà gẹ́gẹ́ bí èso pear ni. Ẹ̀wọ̀n sìn, pear, ẹ wo bí pear ṣe rí. Tẹ́ bá wò ẹ́ rí pé bí bẹ́ẹ̀ náà ni uterus ṣe rí ilé ọmọ. Ó dẹ̀ wà ní abẹ́ ìsàlẹ̀ ìdodo. Tó bá ní ká tẹ̀ fọwọ́ kan, area abo ni uterus obìnrin wà. Obìnrin tí ò lóyún, tí nǹkan kan ò ṣe inú rẹ̀, tí ò sí abẹ́ ìsàlẹ̀ ìdodo báyìí ni ẹ rí bó ṣe rí. Ibi abẹ́ ìsàlẹ̀ ìdodo ni ó fọ́ọ̀lù sí, níbi odò abẹ́. So the uterus is a muscular pear-shaped organ. In our book, Fibroids Explained, you have 7 chapters. 7 chapters, as you can see. So after the introduction, we have the first chapter, chapter 1, Understanding Fibroids. Chapter 2, Fibroids, Causes, Sizes, and Locations. Chapter 3, Fibroid Risk Factors. Chapter 4, Diet and Fibroids. Chapter 5, Exercise and Fibroids. Chapter 6, Natural and Complementary Therapies. Chapter 7, Herbal Remedies and Supplements. These, and we also have bonus. Under the bonus, there are a lot of things that that are there that will benefit you. So now this tells you that you have a lot of things to benefit from this book. If you are here to get your own copy, better do that now. So what I'll be saying or explaining in this series is just an insight into some of those things that we have analyzed and explained in the book. And one of the benefits of the book is that it is friendly, pocket friendly, one. Then we are even having a bonus for this session, 2. Then It is simple and self-explanatory. Self-explanatory. You read and you understand. So now let's continue. So the uterus has 3 layers. It is from these layers, by understanding these 3 layers, that it is this understanding that will assist you as a practitioner, assist you as a patient to understand what you have in you, or the type of fibroid that you have, and how best we can address it or manage it. So the uterus has 3 layers. We have the endometrium. We have explained all these terms in our book. The endometrium, in the medical terminologies, there are some terms that there are some languages that we use. The endometrium, what is the meaning of endo? What is the metria? So the peri and all that. So endometrium, that's a layer of the uterus. That is the inner lining where the menstruation comes from. We have a myometrium, that is the thick muscle layer, and we also have the perimetrium. So now one thing is common now: the metrium. The only difference is the endo, the myo, and the peri. So it is the endo, the myo, and the peri. All this we have explained. So now these are the 3 layers of the uterus that we have: the endometrium, the myometrium, and the perimetrium. So fibroids usually starts within the muscle part of the uterus. Talking about the myometrium. So myometrium, and when it starts from there, it may involve other tissues, especially the fibrous tissue. Especially what? The fibrous tissue. It is this fibrous tissue that makes it firm, because the fibrous tissue is a dense connective tissue. It's one of its characteristics is that it is strong. It is a strong tissue which is made up of protein, collagen fibers that provides support, provides strength and stability to body parts and body organs. So fibers also needs this tissue so for it to be firm. So these are the things that are found in it. Now, the types of fibroids that we have. The types of fibroids that we have. As you have said it, that we have 3 layers of the fiber of the uterus, and fibroids can grow around the uterus. So the types of fibroid depends on where exactly can we see the effects or see the fibroids. That is the direction. One thing that is common in fibroids, I need to say this because I think most people don't know it. One thing that is common in all types of fibroids is that all types of fibroids grow from the same place. I think I said it earlier. That is the myometrium. So what now defines the difference between a particular fibroid and another fibroid is the direction of growth. Some fibroids, after development, after initiation, in our next series, we talk about how it's been initiated. So now, some fibroids after initiation, it will continue to grow inner. Still, is to stay in the myometrium and continue to grow inner, expanding. Some will continue to grow outward, and some will continue to grow inward. So this determines the types of fibroids that we have. It determines the types of fibroids that we have in details. in our book. So then we have intramural, we have submucosal, we have subserosal, we have pedunculated. So intramural fibroid, submucosal fibroids, subserosal fibroid, pedunculated fibroids. So the direction of growth determines the types of fibroids that we have. Now, from the direction, okay, this is how we want to address it. What's the size? What is and what's that? Common symptoms. In fact, some women, they will have fibroids and they will not know that they have one. The symptoms may include heavy or painful periods, pelvic pain or pelvic pressure, swelling or bloating, frequent urination, miscarriages, or infertility. These are common. That's why I say there are common symptoms. There are some other symptoms that might be seen or shown depending on the types and some other related conditions. The question is, are fibroids dangerous? We said it that they are also tumors. Fibroids are also tumors, but they are benign tumor, not cancerous. So that tells us that fibroids share a line with cancers. They have some things in common. The only thing is that their characteristics are different, but they have some things in common. That is the initiation, how it begins. So in our next series, we'll explain that better. We are going to explain that better. But are fibroids dangerous? Are fibroids dangerous? That's the question. So the perfect answer to this will be based on individual patients, the type of the fibroid, the size, and the status of the individual. So that's what will determine the question. Is the person pregnant or not? The age of the person, among other things. But the direct answer is tumors are of two types. We have benign tumor, that is, they are not cancers, and we have malignant tumor, that is, cancerous tumor. Fibroid is tumor, but it is not a cancer. It is what? A benign tumor, even though it can cause some difficulties and some pains, but it is not a cancer. So, as a takeaway, knowledge is power. So you need to understand fibroids, because understanding fibroids is the first step. And if you want to treat fibroids, you need to understand it first. Either you're a practitioner or you are the individual who has the fibroid. So we always say that the cause determines the treatment, and knowledge is power. Knowledge, through learning, you know better. So take charge of yourself, of your health. If you haven't gotten this book, Fibroid Explained, request for your copy today. You want to get your hard copy, it's available. If you want to get your soft copy, it's available. A to Z of fibroids. Fibroids Explained, a comprehensive guide to understanding, preventing, treating, and managing fibroids naturally. Stay connected with Hidden Care Medics for more fibroids awareness tips. And don't forget to follow us to like us, to share our videos. In our next series, we are going to explain causes of fibroids, fibroids initiation, and fibroid vascularity. If you want to see this, stay connected and subscribe to our channels and follow our handles. I remain Dr. Abdulaziz Kolawole Musliuddin, Leading Care Medics.